Your blood really does tell the story of your health. Your doctor just needs to know how to look at it. Your blood, it tells the story of your body. Your blood can tell more about your body than any other single standard medical test that is performed. Your blood relates to every organ system in your body. Obviously, it bathes all the cells and tissues and organs of your body. And it truly is the blood of life. Doctors are not mathematicians, however. And when you take blood from a lot of people, you get a lot of data. To analyze that data, doctors turn to mathematicians for help. And standard deviations from the mean is used in mathematics to find out where people should fall in a range. This makes things simple. Blood reference ranges are usually defined as the set of values 95% of the normal population falls within. These ranges are determined by collecting data from a large number of laboratory tests and a large number of different people. Who decides what's really normal for you, though? And you can see from this graph it's a standard bell curve. When they have a situation where they do tests, if you fall within 2 standard deviations, which is same as others, and probably more or probably less than others, you're considered normal. If you fall into definitely less than others or definitely more than others, that's the only time you're considered abnormal during standard medical tests. This can create a real problem that we're going to be going over in this slide presentation. The problem with this is that your body does not necessarily adhere to these mathematical formulas. Healthy ranges tend to be much tighter than the range 95% of people fall into. This means that many people with health problems are within the normal quote range according to the statistics. But as we stated, they've got healthy problems. And who are you being compared to? Why do people go to get their blood taken in the first place? Oftentimes it's because they're sick. And even if you compare yourself to sick people, you'll always look healthy until you're really, really sick. And this is no way to approach your health problem and eliminate it. And the more and more people that are tested, the wider and wider the ranges become. A healthy range is somewhere in between, as we showed on the bell curve, but the labs use the 2 standard deviations as we said before. Now, when you are in a situation where you fall outside the healthy range, where the arrow is, you may feel okay at that point. And if you happen to go into the doctor and he finds this problem, it's relatively easy to get you pushed back into the health range. But if your doctor is using the standard medical approach of 2% on both ends of the spectrum being unhealthy, you can be where the arrow is now and you still will be considered healthy, even though you may feel terrible. But you go over the magic amount, your doctor says, oh, now you're bad enough we can treat you. Do you really want to wait until you fall into the pathological range to start treating, or is it better if you're just outside the optimum? Let me give you some examples. Because of recent research in Japan, they just changed the level of B12 in the blood that was acceptable. They raised it from 200 to 550. And this change was in response to this very issue. They used to use the same mathematical formulas that we use in America. However, based on recent research, they changed it to 550 instead, a much healthier range. In the US, however, we still have the lowest acceptable range remains at 200. This ignores all the research that's been done on healthy B12 levels recently. Let me give you another example. There are signs of thyroid hormone deficiency, and many of you may have been tested for thyroid. Some of these signs are fatigue, weight gain, thinning of the outer eyebrows, a moon face, thickness in the skin in the back of the neck, as well as abnormal blood tests, number 6. This is an extreme example of moon face in a kid with thyroid problem. But my patient, TS, she came into my office with every symptom but number 6. She had fatigue, weight gain, Thinning of the outer eyebrow, she had a beginnings of a moon face and thickness of the skin on the back of her neck. She had every sign but number 6. And her medical doctor said, no, your thyroid is fine. The blood tests show that you're fine. We see the same exact thing with liver problems, kidney problems, male and female hormones, inflammation in the body, digestion problems, and acidosis as well. We use optimum ranges as a result of this. These are healthy ranges for your blood test results. These are ranges that we compare your results to in order to determine your level of health and what steps need to be taken in order to return you to a healthy optimum level as well. Let me give you some examples. These are patients that I had recently who had normal blood tests done at the laboratory. They brought their test into us. We ran them through our proprietary computer system with the optimum blood values. GW, he had 3 abnormal blood values when compared to the lab ranges, but we found 11 that were outside the optimum range. LF, 1 that was outside normal range, but a 9 that were outside optimum range. A more extreme example, a patient brought his blood tests in and he only had 2 blood values that were outside the normal range, but when we ran them through our computer program, it showed 17 that were outside the optimum range. And I can give you examples like this all day long. You might ask, why doesn't my doctor do this? Among all doctors, there's what's called a standard of care. Medical doctors' standard of care requires that they only treat abnormal findings on blood tests with normals prescribed by the laboratory. Doing otherwise opens them up to possible lawsuits, loss of malpractice insurance, and rid of other doctors. And this is the way they were taught. It's in the best interest of the drug companies as well. If you wait until it's really bad to treat a problem, then there's less chance it can be corrected, and a much higher chance that an aggressive intervention is needed. And if it can't be corrected, then you're more likely to need a prescribed drug for the rest of your life. I've had people tell me over and over, their doctor said, your blood isn't that bad yet. You're not that unhealthy. We can't treat you with medications yet. But is it wise to wait until you're among the worst 2% to do something about your health problem? This is like saying, don't bother to eat right or exercise until after you've had a heart attack. Don't bother with oil changes in your car until you need a new engine. Don't fix a leak in your roof until it starts to ruin your furniture. Or don't treat your health problem until it's among the worst 2%. You might say, but I am really sick. Don't I need drugs to help? If you're really in bad health, you may need medication to get results. But medications are not a way to improve your health in the long term. Drugs are for short-term acute relief, and they should not be used for long-term health management unless all else fails. Once you're over the acute emergency situation, you should look for natural ways to improve your health. You might say, you don't understand, Doc, I'm really sick. Well, let me give you an example of my patient, JC. He had hepatitis C, liver cirrhosis, an enlarged liver, intermittent fever of unknown origin, fatigue, and weight loss. On 6/9 of 2005, they did a liver test. It's a liver enzyme test called GDTP, and his levels were at 652, far outside the normal range. We treated him with a nutritional supplement called Total Liver Detox. He performed a liver cleanse at home, other nutritional supplements called DSF, Virex, oregano oil, multi-immune. These are all things that can be done at home and are easy to do, as well as some diet changes. And on 1/23 of 2006, his exact same test, the GDTP, was at 50, which is just inside the normal range. Obviously, he was very excited about these results. You should get your blood evaluated today. You'll not receive this type of evaluation anywhere else. And having your blood analyzed by these methods is simple and easy. And the cost of the evaluation is often less than the cost of a month's worth of medication that we would be keeping you off of. Thank you for taking the time to listen to this presentation.